Hello, I'm Dr. Rohini. Today I'm going to talk about pregnancy and diabetes. So in case of diabetes, there are two type of diabetes that happens in pregnancy. One is that is already existing, that is the woman would be diagnosed with diabetes before the pregnancy itself. And then there is the second category, that is the woman develops diabetes only during the period of pregnancy and it becomes normal once she delivers the baby. And this is called gestational diabetes mellitus, that is GDM. So next I'll tell you who are these women who are at high risk of getting this GDM, that is gestational diabetes mellitus. That is women whose BMI is on the higher side, that is who have a higher weight, and women who have already been diagnosed with GDM in their previous pregnancy, or who would have had a history of having a big baby in the previous pregnancy, that is weight more than 4.5 kg, and also women who have family history of diabetes, like sister or mother may have had diabetes. And we all Asian population, that is Indian people, are, because of our environmental factors, are on our own at high risk of getting GDM. So these are some of the high risk factors. Now, why are we so concerned about blood sugars in pregnancy? So having high blood sugars, either due to GDM or because of your already diagnosed diabetes, may have some impact on the mother as well as the baby. Now let's talk about the impact on the mother. So for the mother, there is high risk of her developing blood pressure during pregnancy, and there is risk of her getting infection during pregnancy, because high blood sugar will reduce your immunity and it will also make you prone for infections. And there is risk of the woman going into preterm labor, that is delivery happening before time. And also the woman will have more risk of getting a cesarean section at the time of delivery. So, and also there is increased risk of having blood clots in legs and hands. So these are some of the risk factors to the mother. What are the risks for the baby? So for the baby, in case if you're already a diagnosed case of diabetes, so in that case the sugar levels are high from the time of conception, that is the time you test positive your pregnancy. So when the baby is exposed to such high levels of sugar, there is risk of abnormalities in the baby, there is risk of brain abnormalities, heart abnormalities, these can happen. And otherwise, when there is high blood sugar, the weight of the baby can be high during the time of delivery. And even after the delivery, baby may face some breathing difficulties and may require sugar monitoring. And the water around the baby also increases. When the sugars are not controlled throughout pregnancy or during the 9th month, that is during the time of delivery, there is also this risk of baby dying inside the uterus itself, that is intrauterine death. So these are some of to prevent these complications, it's important that we keep the sugar levels controlled throughout the pregnancy. Now next, why does gestational diabetes happens, or why does the sugar worsen in a woman with already pre-existing diabetes in pregnancy? So this happens because of all the pregnancy hormones. So all these pregnancy hormones have a diabetogenic effect, that is they themselves increase the sugar level during pregnancy. So because of this, all this diabetes worsens. So next, how do we diagnose a patient with diabetes, or how do we monitor? So when the patient is in the first 3 months of pregnancy, we do a test called HbA1c or glyco-HB, and we check also random blood sugar or fasting blood sugar. All these things can be used to diagnose diabetes. So when you find high sugars in the first trimester, it is most likely that the patient might be suffering from already diabetes and it was just diagnosed. For a healthy pregnancy to continue, for the baby to be fine, we expect a control of HbA1c around 6.5%. It should be around at that level. Other than that, usually the pregnancy hormones which increase sugar increases in the second trimester, around 24 weeks onwards. To diagnose gestational diabetes, we usually check blood sugar between 24 to 28 weeks. So in that case, there are two types of tests. One is OGTT and another test is DIPSI, that is Diabetes in Pregnancy Society of India recommended test, kind of glucose challenge test. So these two tests are used to tell you to diagnose GDM in the second trimester. And other than that, already diagnosed patient with GDM or already diagnosed patient with diabetes, the sugar monitoring would be done in such way. Your fasting sugars have to be checked, and your post-meal sugar, either after 1 hour or 2 hours, has to be checked regularly. So post-breakfast, post-lunch and post-dinner has to be checked. So this has to be done in frequent intervals. So this is how your blood sugars are going to be managed. So I gave you just about how to diagnose high sugars in pregnancy, what impact it has on mother and baby, and how we are going to monitor your sugar levels. In my next video, I will talk about how are we going to manage these high blood sugars in pregnancy.